just want to share that, and we added in the document we shared, the reason we have the health and safety plan proposed is because we're required. There are no changes. You can see in the document where we are at this time. I think the start of the year has been pretty refreshing, and if, as we move forward, things were to change, we have some guidance here, but also, I'm in communication with the folks from the county on a regular basis through our superintendents of our county IU. Obviously, our nurses were in communication with our local healthcare providers. They're also a great resource to monitor our community. And so if something happened we didn't foresee, then we would simply come back if we believe we need to make some changes. But right now, this is a requirement of us because of the third year of the funding, the federal funding, and we have to show this on our website. So as you can see in the document, we are aligned with CDC guidance, and we're not reporting cases. We're not. Our nurses are resources for families. I think everybody over the past 2.5 years understands what we're dealing with and making decisions over what they want to do with their family as far as vaccines. Thankfully, everything's much more readily available. We had a reflective conversation earlier about when things were rolling out initially, and the role schools played. We're in a much different place, thankfully. And if we can go back and redo the past 2.5 years, I know where I was, we would have done things differently. I'm sure it would have been the case here too. So, Megan, from the health staff that you oversee, is there anything else you want to share with where we are?
I don't think so. I think you hit the nail on the head. I mean, at this point in time, we, I think our families in the community have information about the vaccine, about COVID guidelines as far as quarantining when you test positive. Our nurses are up to date with the CDC guidance, as well as any updated information from Chester County Department of Health. Certainly, our families are welcome to reach out to our nurses if they have additional questions. There is information on our nursing page in the district if you have questions about whether you've been exposed or you've tested positive, just some guidelines on what to follow. But additionally, your local health physician, your physicians can help answer questions as well regarding COVID symptom and exposure. Thank you.
I just have one question about it, and that is, so we have the safety plan, and I know it was put in place for COVID. I think last time we talked about it, I had asked if this is only related to COVID, because that's what our experience is, and I think the answer was not necessarily. And if I'm wrong, am I wrong? Yes or no? I do know that it is. I think I was more thinking about the fact that we have a health and safety plan. Is this, my question really is this something that will continue aside from the fact that we're getting funds based on filling this out? Or is this, as soon as they say you don't have to do it anymore, we're done?
Right now, obviously, we're in a different place. To say we're in a pandemic like we had been, this is very different. So I don't envision us, if we're dealing with something that doesn't have, hospitalizations that we're seeing, or people aren't even calling to their family doctors for treatment, then I don't think we would have a specific pandemic plan. But I think time remains to be seen. If things keep going the way they are now, I don't think we would have a plan. I don't think there's a need for one. I think we play a role in educating our communities. Our nurses have always been resources for our parents. So that would continue even if some new strain came about. Good question. I don't know the full answer down the road, but right now I don't foresee that being something we would need. We want kids in school every year. We're going to suggest people talk to their physicians about their flu shots. We don't want kids missing school for any reason. Hopefully not.
Dr. O'Donnell, would it be safe to say that we would resort back to our policy 203, communicable diseases?
Yeah.
Which is, I think, one of our neighboring districts is already referring their families to that policy at this point in time.
Yeah. Thanks.
Any other questions or comments on that? I had some follow-up questions.
So right now, I understand that why we're doing this and what we're required to do is reevaluate this plan every 6 months. The way that it's, written now is that, we'll reevaluate, in consultation with the Department of Health, PDE, DOH, CDC. So I guess right now we know that, the metric is community action levels, and we're like in a good place. My question is, what is our metric for reevaluation? Because, right now it's every 6 months. We know that this is a dynamic, our experience is that conditions can change. So I have reading the plan now, there's uncertainty when we will reevaluate. So I'm looking for clarification on what that looks like from a practical execution.
Well, I'm going to answer with, over the past 2.5 years, we started out with zero flexibility when they had the red, yellow. I mean, we didn't know what we didn't know. I think right now what we're suggesting is let's look to the experts, and we'll come back if we foresee something adjusting. We're talking to the county health folks, looking at the CDC, talking to our local healthcare providers to monitor our community, and let's see where we are. I think I don't to sit here and predict some arbitrary metric when if you would have said at the front of the pandemic, remember last January, we were seeing cases galore. If we would have just had an arbitrary metric, even though people weren't really getting that sick and hospitals weren't filling up, I think that would have been pretty misinformed. So getting all the current information we can get to make informed decisions to what's the right path, because pediatricians I worked with to tell us we would have had to make a decision to physical distance or close schools. Even masking was a concern, because they were sharing with me they were giving out more Prozac than antibiotics the past 2 years. They wanted kids active. So I think we'd want to look to the health department, our healthcare providers, as well as see what the CDC is saying, because what they say could change too. If we want to look to CHOP, we have a great resource in this region to give us their feedback as well and share what we're doing and why. So I don't have a metric for you in a proposal. I don't know. I mean, I'm looking to the people in this region who are experts, and none of them are giving us metrics.
So, there's guidelines that CDC, that the Pennsylvania Department of Health and the PDE are recommending, and they refer back to CDC guidelines, and that's what we're following. Like, that's the way that it reads. It doesn't say that we're following those guidelines or that we will follow those guidelines. It says that we'll evaluate those guidelines in the future. So that's, I guess, an unclear time frame or metric.
Everybody's saying, hey, you need to stay the course with CDC. Yeah, and that's what our healthcare providers are saying. And they're saying if you're in level 1, right, and they're all telling us that you need to change your mitigation, then that's the guidance we're going to take.
Should conditions change and worsen, you're saying that we have the flexibility in this plan, and our action would, change consistent with the recommendations for that next action level?
I'm going to say it depends. I know I sound like an attorney, but we're not there. Sorry, Steve.
Yeah, I wouldn't be comfortable trying to assess any kind of metrics right now, and we don't know where this is going, and hopefully it's not going anywhere. And I think that the other thing we need to be careful of is that, we did check with the experts as best we could. At one point early on, Chester County was doing worse than other places, and we were stricter. But then there was at some point, I just checked today, 90% of Chester County is now vaccinated. So if you're you know, if CDC is putting out regulations for the entire country when the average is 60%, it might still be different for us because our community isn't at the same level. So to your point, we have to check with the experts. We can't make a metric now.
The CDC's metrics are community-based, they're county-based.
Or-
So not nationwide or anything like that, right? So it is more localized to.
Right. So I think we have to see what they come up with. I know people were not happy with decisions we made, and I certainly can respect that, but in my heart, I looked at what, especially when the health department started getting into and I hesitate to use the word politics of it. I was looking at CHOP, DuPont, and Johns Hopkins, the three hospitals I would take my children and grandchildren to, and I was following what their I was comfortable with what we decided because we were following their recommendations. So I think this policy, our ESER's health and safety plan gives us that flexibility. It says we'll continually reevaluate. So I don't see the need to make any changes to it right now.
I feel like that's what we, worked on, the wording for this. We wanted something that would give us the flexibility, and I think that's why we did word it the way that we did, so we could, when we reassess, we could decide to go in any direction that we think is the right way to go.
Right.
Which is why it's worded in that way, and it's not
So
specific.
it's worded that we're gonna develop essentially our own plan, right, in consultation, our own guidelines is exactly how it's written here, in consultation with these other organizations.
I think it's worded that we can do whatever we want, which is kind of sad that that's where we were, that's the hand that we were given with this whole thing. And we had, meetings, we made a lot of changes, we turned quickly, we listened to the guidance, and I feel like we would do that again. I feel like we would, as a board, be able to assess what's going on right now and what's our best path forward. I don't want to make those decisions. I don't feel honestly qualified to make medical and scientific decisions, but I think that that's why I like the wording of this, and I was happy with the wording of this because it doesn't say specifically what we will or will not do, because we don't really know.
So in that light, then, so again, practical execution, we want that flexibility, and I appreciate that and understand that. So again, this is a plan with the intent to what are we going to do should conditions change? We have to kind of consider those undesirable outcomes and those worst case conditions, right? So that's where I'm looking at this guidelines in this plan to how do we pivot should those conditions change? And that's what I want to be clear with, what is that future path forward? And that path forward is bringing it up that, hey, things are changing, we need to reevaluate, and having a future special session that's advertised so we can identify that need in the future, and that's consistent with this plan, and then address it through special session and, public notification. So the ability to pivot or reassess can happen in a fairly short window to meet environmental conditions as they potentially could come up.
I believe that it can, and the law says that we can do that because it's a health and safety matter. We don't have to wait till the next meeting, or am I correct in that?
Let's look back at this spring of 2020. We didn't have meetings. We went online without having meetings. And we I hope and pray we don't ever encounter that again for our kids and us. But we have the ability to pivot, and it takes, it's tough. It takes courage. It takes people. My approach to it was to get the smartest, brightest people who can inform us, and I was going to out-expert you, the head of infectious disease for one of the largest research universities and the pediatricians of our largest healthcare providers in our region. And we circled up every week, and we had lunch on Google Meet, and we checked in. So my hope is that you'll be comfortable if we monitor this through our healthcare professionals. We have healthcare professionals in all of our schools as well to help us keep tabs on kids. Our attendance right now is great with our employees, and we know there's some cases going around. Thankfully, I think the rate of vaccination is pretty good here, and we're doing well, and we're back. And we've had a lot of large gatherings inside as well. And I appreciate those of you who can make our opening day. And we're doing pretty good. Hopefully it continues. If it doesn't, we'll report back. And fortunately, we have some pretty bright people in our region that could tell us something's coming. And, that would give us, an opportunity to circle up and share what they're saying and what advising we're getting. I know that's my thinking. I know I haven't really had this orientation with you yet, but that's not a clear metric, but that's my belief on how we should do it rather than just making some arbitrary threshold.
And I think the health part is the mental health as well, because as a teacher, I see so many misses this year, just with children trying to get their feet back in the water and let's just catch our breath and maybe have a little bit of a regular school year for here. And then, of course, we're watching the metric. We're watching what's going on, and they're paying attention to them. Our school nurses are amazing, but I do think children just need to be in school, and I just think there's a mental piece that brings about a general wellness to a child when they are where they need to be. So
Absolutely. This whole plan's based on with the goal of keeping kids in the building, right? I think that's something we all want and are striving for this year and, every time frame. So it's just, how can we best do that is the question.